Is it really necessary to vaccinate my pet? Pet owners may wonder whether pet vaccinations are really necessary, or if they're just a money-making ploy. Some people are also concerned that immunizations could be unsafe. As a pet expert, it's critical not to pass judgment but to empathize with the owner, regardless of whether the fears are justified. Pet immunizations save lives and are a crucial tool in keeping our pets healthy, which you may emphasize. Furthermore, the benefits of vaccination in terms of disease protection greatly outweigh the risk of a negative reaction. According to the Australian Veterinary Association, considerations such as the particular animal's health status, age, and the anticipated consequences of maternally produced antibodies should all be considered when deciding whether or not to vaccinate. In addition, the animal's specific disease and environmental risks, as well as the duration of immunity of various vaccines, must be taken into account. Pet specialists play a critical role in educating pet owners about vaccines, clarifying their concerns, and recommending the most vital immunizations. Tissue swelling around the injection site, moderate indicators of illness such as fever, tiredness, and discomfort, and allergic reactions to the vaccine that can range from mild to life-threatening are the most common vaccination consequences. The chances of your pet having a dangerous reaction are minimal, but the chances of him obtaining a life-threatening disease if he isn't vaccinated are much higher. Your veterinarian will examine a pet's risk of exposure to a disease to determine whether he should be vaccinated against it. So core vaccines for dogs, according to the AAHA Canine Vaccination Guidelines, include canine distemper as a disease that affects the respiratory and nervous systems of dogs and is often fatal. Infectious hepatitis is a type of hepatitis which is caused by the adenovirus type 1, can cause acute or chronic liver inflammation. In unprotected puppies, parvovirus causes severe vomiting, diarrhea, and dehydration, as well as life-threatening sepsis. Rabies is a disease that causes gradual neurological disorders and death, and it is spread to people when an infected animal bites. Which vaccinations do I need to give my cat? Core vaccines for cats. According to the American Association of Feline Practitioners, feline immunization recommendations include feline herpes virus 1, feline viral rhinotracheitis, infectious respiratory disease with a lifelong infection that causes recurring flare-ups in cats. Calicivirus causes respiratory illness, which is commonly accompanied by oral and nasal ulcers. Panleukopenia infects kittens in utero, causing life-threatening blood cell deficits, vomiting, diarrhea, and dehydration, as well as brain damage. Vaccination is the most effective and safe way of disease prevention. Inquire with your veterinarian about the immunizations your pet requires.